quality of mucus in the cervix may be becoming more receptive. The thick viscid mucus may get dissolved by Uttarabasti. The quality of mucus plays a major role in the reception of the spermatozoa, so that may be getting altered by administration of thyla or the grata, thereby facilitating the pH in the vaginal canal. Even the microbiome theory, which is encroaching into gynecology in these days, the administration of Uttarabasti into the uterine cavity might be changing the pH in the vagina as well as in the uterine cavity. And this change in pH in the vagina or this change in pH indirectly may be influencing the microbial symbiosis in the vaginal canal. Thereby, it might be helping in the conception. The immunological factors, immunological infertility particularly is at the level of cervix. So by administering the Uttarabastis with the thyla or grata, maybe indirectly acting on the immune factors and thereby facilitating conception. And some of the gratas and thylas having the antioxidant, anti-inflammatory and anti-infective, antimicrobial properties might be overcoming the local infections, because the fine crypts in the cervical gland are so narrow and so micro that even the antibiotic concentration at this level is found to be reaching the desired concentration of antibiotics at this level is said that it is difficult. So the locally administered drugs may be very effectively delivering this desired action, and thereby they might be helping in conception. If we come to the level of uterine cavity, uterine receptivity or the endometrial receptivity is taking an upper hand in the conception discussions nowadays. So our gratas or the thylas might be acting indirectly on the endometrial receptors, and at the level of receptor, they are enhancing the receptivity of the endometrium. So prostaglandin levels within the uterine cavity, within the endometrial cavity, is said to be one of the hindrance or one of the facilitating factor for the conception. So when we administer some foreign drug inside the uterine cavity, being anti-inflammatory, antimicrobial in nature, they might be acting on the prostaglandin levels or prostaglandin concentration, and they are bringing about an environment inside the uterine cavity which facilitates. Same thing with the inflammatory modulators. Many of the infertility cases are found to have altered inflammatory mediators or modulators inside the uterine fluid of the uterine cavity or in the peritoneal fluid. So these immunological factors of infertility and inflammatory modulators of related or linked with fertility might be brought into a favorable turn by administration of Uttarabasti.